I'm Dr. Lisa McMahon. I'm a pediatric surgeon at Pediatric Surgeons of Phoenix and the Chest Wall program at Phoenix Children's Hospital. This is a video for exercises geared toward patients who've undergone Pectus surgery, and I'm here to introduce Alex DeWolf and TJ Wilson. TJ is a pre-med student and an athlete, and Alex DeWolf is a PA student and an athlete. These exercises that we're going to do can be done anywhere. You can do these at home. You don't need any special equipment. They can be done sequentially, together, or separately. The exercises with weights should be done after 2 months. The first 2 months are going to be geared mainly towards stretching and gradually building strength. The most important thing to do immediately post-operatively, however, is to gain cardiovascular strength again, and so walking is very much encouraged. Wide grip seated row. Sitting up straight with your back against the wall, bottom touching. Sit up straight, bottom touching. You can do this with either a resistance band or with weights. Bring your arms forward towards your feet like a stretch, but do not let your back leave the wall. And then bring your arms back so that your upper arms are touching the wall. Breathe and repeat. These are back exercises. You should be feeling this in your back. Try not to lock out your elbows and keep this as fluid as possible. The slower you go, the better the exercise. Start off with just a band and then gradually increase in weight. You should not use any weights before the first 2 months after surgery. Bent over rows. Stand up straight, keep your abdominal muscles tight, and bend forward slightly. Make sure your back is straight when you do this. You can bend your knees if you want. Initially, you're going to have your arms sort of slightly in front of you, and then you're going to bring your elbows back towards your sides and back, squeezing your shoulder blades together. Do this slowly, breathing each time, and repeat. You'd like to do 10 repetitions, at least 3 sets of each. A variation of this is the bent over fly. In the same starting position, bring your elbows out towards the side, arms out. You can keep your elbows bent, and repeat. It's important to make sure you breathe and you keep your abdominal muscles tight and your back straight throughout this exercise. Again, 3 sets. This is a chest exercise. You can stand up next to the wall and then slightly sit on the wall. Lean your back into the wall completely, supported by your feet. And keep your head in neutral position, arms either to the side or in front of you. Bring them up in front of you, and then bring your arms back, hands back toward the wall, elbows bent. Bring them forward. If you do this very slowly, you will feel it. This is a great chest exercise, but it needs to be done in a very controlled fashion. You don't want to rock back and forth. If you keep your abdominal muscles tight here too, it'll help with your core. Again, start with light weights. These are shoulder shrugs. And after you've warmed up your shoulders by doing the rolls, you can start with this. Grab light weights in each hand and just elevate both shoulders towards your ears and then bring it back down. Again, and hold for about 3 seconds and bring back down. After this exercise, you're going to want to stretch out your shoulders as well, doing the same shoulder stretches that we did before. Lateral and front raises. Standing straight with your feet shoulder width apart, your shoulders stacked over your hips, and abdominal muscles pulled in. Lift your arms laterally to the side, slowly, and back down again. Don't lock your elbows. Keep your wrists straight. Make sure you breathe. Alternately, you can do front raises. This time in the same starting position, lift your arms in front. Make sure you don't rock back and forth. Keep your body straight. And repeat. You can alternate between front and side to change up the exercise a little bit. Ideally, you should be able to do 10 repetitions of each side, sets of 3s. Good job. Shoulder press. With weights in each hand, you assume the sitting position that you did for the other exercise, with your back completely pressed against the wall. Bring your arms up to the side and press upward. Slowly, don't lock your arms out and come back down. And repeat. Make sure you're breathing. Hold your abdominal muscles in. And repeat until fatigue. Or 10 reps, or 3 sets. When it gets too easy, increase your weights.
Hi, I'm Jackie Hurley, the Pectus Program Coordinator for Phoenix Children's Hospital, and I hope you have enjoyed this video. If you have any further questions, feel free to give me a call at area code 602-933-4246. Thank you.